I'm going to speak now, so I'm just going to invite myself up to speak. I'm going to take it in a little bit of a different angle from what we've just heard. So today I wanted to share a little bit about how you can actually be engaged with research and what being engaged with research might actually involve for you. And so when I say engaging with research, there's really three key areas I wanted to cover today. So that's about reading research articles, finding and reading research articles, participating in research studies, as well as being a consumer representative. So what are research articles? Many of you may know, but basically they're papers, manuscripts, publications, they're all the same thing. They're a way for researchers to primarily communicate to other researchers. So they are written at quite a technical level, not necessarily for the general community. What I wanted to kind of note here is that not all articles that are published that you may find online that looks like a good article is necessarily the same quality as the paper next to it. They're not all trustworthy. Some have more rigorous research underpinning them. Others have been reviewed by experts in the field, which is called being peer reviewed. And I think, others might be poorly designed. They may be published in what's called a predatory journal. So it means that one article isn't always the whole truth. It's just one piece of that puzzle. And we know with the IRD research is moving so quickly, it's a puzzle that often continues to grow and evolve as we continue on. So where do you actually go to find these research articles? There's a few ways to do this. The three platforms I wanted to mention, the first is PubMed. And you should have hopefully all received the slides. And if you hadn't registered, I will email through these slides so you've got all the links and everything. But PubMed is a free database with millions of articles from trusted medical and scientific journals. And it's a great place to start for what are peer-reviewed articles. Google Scholar is also a great platform to use, and it covers a wider range of academic sources. It's a bit more user-friendly, I must say, and it often can link you directly to the full text articles. Not all articles are freely accessible if you're not associated with an institution or a research group. And this is where ResearchGate is another great platform that you can use. And so ResearchGate really is just like the social media network for researchers, where we can upload our articles and share and comment on each other's articles. So often you can go into the ResearchGate and email a research directly saying, I saw your paper, can you send me a copy? And they hopefully will check that and get back to you. Okay, so you found a research article, you want to read it, but it's this huge document, lots of text, can be quite overwhelming. That's pretty fair. They can be quite intimidating at first, but I think understanding the general structure of a research article can help you more confidently navigate through those. So they often start with an abstract, and this is the short summary of the article. It gives you that quick overview, the gist of what you want to know. Then it moves forward to the introduction. This is the scene setting. It explains the background, why the research is needed, and what the researchers are trying to find out. After this, there comes the methods, and this is what was done, who was invited to participate in that research, what data was collected, what was the intervention if there was one. Then we have our results, which is the reporting of what was found. And then really the juicy part is the discussion, where the researchers take their key findings and interpret them within the context of other research findings and what does it actually mean, and how does it matter in real life. And then the conclusion provides that really broad take-home message. So having an understanding of this structure can help you better navigate articles and mean that you can hone in on areas that are most important to you. So rather than overwhelm yourself with all of the statistical analyses, potentially, you could go straight to the discussion and read up about that. So overall, I think staying up to date with academic research is a great way to stay informed about your condition and about emerging treatments that are coming through, and ensure that your understanding is backed by proper evidence as opposed to something that you might have seen on, I don't want to say a current affair, but I'll say a current affair. And it also can help you feel more confident when you're talking to health professionals, knowing which questions might be relevant questions to ask and being more engaged in your healthcare. However, I do fully acknowledge that research articles can be, one, quite difficult to understand. They're written at quite a technical level. They're also not often in an accessible format, which is quite a challenge. They may not be free to access. And then I think the other thing to acknowledge is that if you think about the research pipeline, it takes many years to get to a clinical trial, but then it takes many years to publish the findings of that clinical trial. So what you might find today, we might be sitting on data that we're still working through, we're analysing, we're writing up, that we understand that knowledge, but we just haven't published it yet. So it really has a limitation of how recent that information is. And not all research that gets done does get published. There might be, and it's a flaw of just the academic system, is that studies that have negative or inconclusive results may not get published. Studies just might be small or poorly designed, or there's a lack of resources or time to actually get the articles published, so that can be a challenge. But there are other ways you can access research updates, and this information can often be more digestible. It's in a format that's hopefully more accessible, and in a way that patients actually want to, what they want to actually know. And it can sometimes even be updates before those clinical trials or new research studies have been formally published. So attending events like today is a great way that you can do that. Webinars that say Retina Australia might host, or the Centre for Eye Research might host, are a great way of staying abreast of research progress. You can check websites of relevant research groups or pharmaceutical companies. So the Centre for Eye Research and Cerulean are great options. And I've seen a lot of people over at the Retina Australia booth, but I highly recommend signing up to their newsletter, because that's a way to stay engaged. Follow them on LinkedIn, which I know, like, no one wants to have another social media platform to follow, but LinkedIn is a great way to get regular updates and lay summaries of research articles that are coming through from key researchers, especially across Australia. And also, in the email I send out post-event, I've listed key researchers, people like Lauren Ayton, to follow on LinkedIn, to kind of stay in touch with people that are progressing this field and who are advocating for this community. Okay, so we've covered, and hopefully now you're all researchers and you can understand what research articles are and how to get them. But what happens if you want to be one of these research participants in a study? How do you participate in a research study? So I think it's worthwhile to acknowledge that there's different types of research studies that you can be involved with. And I know we've talked predominantly about clinical trials within the context of treatment. And these are what are called interventional studies. So researchers actively want to do something, to treat something, to see what happens. But these trials or interventional studies could also be a behavioural intervention or a behavioural trial. So for example, we want to see what is the change in well-being or outcomes for people who go to a peer support group versus a one-on-one counselling session, to understand how can we better support the community. But then obviously we have our clinical trials and new treatments. I'll just kind of quickly run over this because Tom's already mentioned this. But when we think about clinical trials, obviously we have our preclinical research, which is super important, work that Anay and Livia are doing. If that's proven, it's all good and sound, we move forward to the clinical trials, the early phase clinical trials. Phase 1, is it safe? A phase 2 trial, then does it work? Phase 3, is it better than other options? After these phases, and really the number of clinical trials that get through from phase 1 all the way to approvals is quite small. So just because it gets to a phase 1 doesn't mean it will ultimately become approved. I think it's about 10% if we look at all clinical trials across medicine. After the phase 3 trials, that's when it goes through to potentially get approved by what's called the Therapeutics Goods Administration, or the TGA. So they review it and determine whether it should be approved within Australia. After the approvals, there can be a phase 4 clinical trial, which really looks at the long-term outcomes. How is it actually working in the population, and what are the long-term outcomes? And alongside that, there is a review by subsidy assessment committees, and this is where they determine whether a new treatment should be subsidised by, say, PBS. As an example of that process, Luxturna, which we've talked about a few times, it was approved by the TGA in 2020, and it was only approved by to be jointly funded by federal and state governments in 2022. So there can be a little bit of a delay in that. Observational studies, on the other hand, so we've got interventional, like clinical trials, and then we've got observational studies. And I think Livia had touched on this. Observational studies are so important to help determine or provide the framework and the foundations for which we can then follow on to do the interventional studies. So observational studies, we watch, we record to see what happens without really changing anything. So we don't assign treatments or anything like that. So we've got natural history studies, and that is a really great way to understand how the disease progresses over time. And also surveys and interviews. I know a lot of you have participated in my study, where we want to understand what matters to you, how do you make treatment decisions, what would be a meaningful impact for you, how can we deliver these treatments so that as we progress along the pipeline, whatever treatment does become available, it's available as soon as possible, and it's also delivered in a way and available to you in a way that you want. Being a part of research, I think for the researchers, it makes sense, right? Like, you help us help improve the healthcare, but that obviously leads back to you. But there's kind of more personal benefits for participating in research. So you may feel a satisfaction in contributing to research, whether that's going to support you or not, potentially. There's practical benefits like payment. Sometimes research studies can offer payment, or just an opportunity to learn more and connect with other researchers. You build relationships with those researchers, and so you can get involved and find out about events like this. And I put a little asterisk here against this one. Sometimes with clinical trials or natural history studies, for example, you can potentially access more frequent monitoring and specialist care just because you're having more regular visits than you may potentially do otherwise with your ophthalmologist, which might be once a year or 2 years. If you do want to participate in a clinical trial, a research study clinical trial, you can search for these online. I'm going to note that it isn't a platform necessarily made for the general public, nor for people with a vision impairment. So it can be quite hard to navigate, but it is there. So you can search for clinical trials online, what you do, and I've got a how to do this in the document I send out post-event. You can specify the condition and the location of a clinical trial, and then it comes up with information about those trials, and you can see where it's the clinical trial is being run from and who's leading it. So you might see a trial that Tom Edwards is leading, and so you can assume from there it's a reputable study. So I might investigate a bit further because I think I might meet that eligibility. And of course, like, even if that comes up as a clinical trial on that site, that doesn't necessarily mean that you should go ahead with that clinical trial if you think you are eligible. It's always important to discuss any clinical trial participation with your trusted healthcare professional to know whether it's the right choice for you, and to make sure you're appropriately informed. Other ways to get involved with research studies, whether it's interventional or observational, is connecting with community organisations, as well as being a part of the inherited retinal disease registries that we have. So I think Lauren might have mentioned the national and the state-based registries. So we've got the Venture Registry, which Lauren and Cece lead, the Australian IRD registry over in WA, or that's national, yep, sorry, national, and then the WA Retinal Degeneration Study with the Lions Eye Institute. And so being a part of those registries make it easy for the researchers to contact you when any relevant research studies come up or clinical trials that match your condition. And just to wrap up, I just wanted to touch on what it means to be a consumer representative, because that's a little bit different to being a research participant. It's more partnering with researchers as opposed to participating in their study. So consumers is a term for people who have lived experience of a health condition. You might have the condition, or you might be a caregiver or a sibling. Many researchers now are requesting support from consumers because it helps guide our research to make sure it's most meaningful. And these consumers advise and guide the research process at that high level in partnership with the researchers. They can review the study plans of how it's delivered, study materials like participant information sheets. And in this role, you're acting as a research partner. So it's a great way to really connect with the researchers, and you don't need to have a research or a medical background to do that. And just to wrap up, I think it's great that we're having all of these research opportunities come up, and there's a lot of hope for the community. But I think it's really important to also end on the fact that you have rights as research participants and as consumers. So your participation is always voluntary. You can always withdraw your consent at any time without needing to give reason. You have the rights to be appropriately informed, to take your time to make decisions, to ask questions, including about risks and benefits, what your role or responsibilities might be, and to negotiate your contributions potentially. So for example, if I had an interview study, I don't feel comfortable with that, can I get the questions ahead of time? So you have that right to do so. You have the right to privacy and confidentiality, to request a copy of any research findings and study updates, and also I think, and really important, to provide feedback or make a complaint about the research process if you haven't been happy or if you felt discomfort in any way.